Fillers or fat grafting? Which is right for your face? This is a common question asked to us by many people. Both of these are options to improve the volume of the face, but they have their pros and cons. To understand these nuances, we're going to discuss 6 points in which fillers and fat grafting differ from each other and understand which might be the right option for you. I'm Dr. ANIKETH VENKATARAM, plastic surgeon at the Venkat Centre for Aesthetic Health, Bangalore. Point number 1, material. What are fillers? What is fat grafting? So a filler is a chemical jelly-like substance that comes in a syringe. We inject it where we want and it fills it out. This chemical is called hyaluronic acid. It is manufactured at different concentrations and different properties. So different fillers have slightly different characteristics. You get softer fillers that are good for softer areas. You get firmer fillers that you put on the areas such as the bone. So a filler is a jelly that has some shape to it. Think of a gummy bear, something like that. This is a non-surgical treatment because it comes in pre-made syringes and we inject it where we want. Fat grafting, as the name suggests, is to use your own body fat. It is autogenous tissue. So we take some fat from the stomach or the thighs and we inject that into the face. So fat is a living material. It is just like the fat in your body. This fat has no intrinsic shape of its own. It's not like a jelly that you put it and it stands. It is a little bit like a liquid, semi-solid. So it takes the shape of whatever you put it into. Point number 2, the procedure. How is the procedure done? Fillers are a non-surgical treatment. It is done, it takes half an hour. We apply a cream on your face that numbs the face. Then the filler injection is done. You come get it done, go home the same day. Fat grafting is a minor surgical procedure that is done under local anesthesia. So you're awake during the surgery. We give some medicine in your stomach through a small hole and we suck out the fat with a syringe. We give injections into your face to numb your face and we inject the fat through tiny cannulas. Cannulas are like very small needles which are blunt. So we make small holes and we inject the fat. So there is no cut, there is no stitch. Point number 3, recovery. Fillers being a non-surgical treatment, you can be almost normal the next day itself. You need to avoid heavy alcohol, you need to avoid heavy exercise for around 24 to 48 hours and then you can be completely normal. Almost the same day itself, no one can make out that you have done something. Fat grafting has a little bit more of a downtime. You feel pretty okay the next day itself. You can do your activities, work on a laptop, work on a computer the next day itself. But your face will be a little bit swollen. For around 4 to 5 days, people can make out that you have done something. So for you to go outside and show your face and people not to know that you have done something, that will take around 5 days. Point number 4, result. Let us talk about what fillers and fat grafting can do. Fillers are good only for volumizing. They add volume. They're not going to do anything else. So if we want to fill, it fills it out. Now the good thing is because I said it has some structure of itself, we can use it for very fine work. You can put it in very fine areas. You can put it for like just the lips to give a small increase. You can put it in a small area in the under eye to give a small increase. So it is very good for very fine work. Fat grafting, along with filling, it also has stem cells. So it improves the color and texture of the skin. So that is one advantage. However, as I said, fat has no shape of its own. It takes the shape of whatever we put it into. So it's not good for very fine work. We don't use it when we're trying to do a very small thing. We don't use it in the lips, for example, because the lip even a half a millimeter is visible. So it is good for larger areas where there's a huge amount of volume loss. Point number 5, longevity. How long does it last? Fillers last for around 1 year, 1.5 years if we are lucky. After that time, it gets broken down by your tissues. Now typically when it goes away, it doesn't go completely away. It leaves a little bit behind. So when someone has done fillers multiple years, they might feel like they don't need it anymore. Fat grafting on the other hand, it behaves how fat behaves. So it can last really long as long as you maintain yourself. We've been doing fat grafting for over 10 years and some of my earliest patients still have that fat. But here there are 2 things to understand. Number 1, all the fat that we put in the face does not survive. Fat is a living material. It has to get blood supply. The fat which gets blood supply lives. The fat which does not get blood supply doesn't live. Usually in the face, around 80% of the fat that we put survives. But sometimes that is 50%, sometimes that is 100%. There's a little bit of unpredictability there. With fillers, you put 2 syringes, for example, you will get 2 syringes worth of result. With fat, most of the time, the fat survival is very good. Rarely, in around 2% of patients, 1 in every 50 patients, if enough fat hasn't survived, we have to go back in and we have to put a little bit more. The thing with fat is you can always put more, but if you put too much, it is very hard to take away. Point number 6, cost. Now here, it's a bit of a tricky situation. In terms of a one-time cost, obviously fillers are cheaper. Fat as a surgical procedure is going to cost more. So in terms of one-time procedure, fillers are cheaper. But if you have to do it again and again year over year, then the costs start building up. So because fat lasts longer, in the long run, it can turn out to be less expensive than doing fillers. So ultimately the final point, who is a good candidate for fillers, who is a good candidate for fat grafting? Fillers are good for fine work. When you're trying to improve the lips, when you're trying to improve a small area of the tear trough. So when you don't need too much volume, fillers are a good option. They're typically used in a little bit younger patients, 20s, 30s, 40s. Fat is good when you need a larger volume of material. When you have deep under eyes, when you have deep hollow temples, when you're trying to fix multiple areas at once, and if you have to put a large number of syringes of filler, that is going to work out very expensive. Fat is the better option. So fat is typically good when someone's a little bit older, 30s, 40s, 50s, 60s. There are exceptions, of course. There are cases where older people who have retained good volume, fillers work well. There are cases where younger people, for example, they have deep dark circles, deep hollowness, fat grafting works better. But as a general rule of thumb, younger age group is better for fillers, older age group is better for fat grafting. Let us now look at some examples of both fillers and fat grafting. So here I hope this helped explain the concept of fillers versus fat grafting for you. Both have their place. Both have their pros and cons. Typically in many patients they start off doing fillers and then when they want something more permanent, they end up going for fat grafting. Or for someone who wants fat grafting, they don't have the time to undergo it right now to recover from procedure. They do fillers for a year, kind of like a test drive, and then they go in for the fat grafting. So they both have their place and you need to visit your doctor to find out which is the better option for you. Do like, share and subscribe. Thank you. Have a great day.